Well, dental students from Adelaide University are literally putting the smile back on the faces of homeless people. A free dental clinic in the city is training students and helping those most vulnerable regain their confidence. Caroline Winter has the story.
It's not been an easy life for Maureen McCallum.
Morning, birds. How are you?
Born in Oodnadatta, she moved around a lot, worked in Whyalla and raised 2 sons.
Hey, baby girl.
But a string of traumatic events left her homeless on and off for years.
How you going, Bippy? I lived out of a motor car for about 2 years. Suffered, mental illness and quite a lot of disadvantaged. What's Brenda up to? Hello, Brenda.
Maureen McCallum has finally found security and safety at Common Ground in Adelaide, which provides accommodation for low-income earners and the homeless. She's also found solace and renewal in some unexpected companions.
So the birds have been a bit of a godsend, I think, and didn't really see it that way initially, but I really can't do without the birds now. And I've learnt a lot from the birds, learnt coping skills, I think, like responsibility and time management.
But what she's been through has had a huge impact on her health and well-being. She's suffered a heart attack and has had double bypass surgery. Her diet has been poor and anxiety and stress have kept her well away from a dentist for years.
Good morning, Maureen. Would you like to come through?
Thanks.
How have you been going? Good?
Thank you.
Come through.
She's now facing those fears with the help of students from Adelaide University. Thanks to a $250,000 Commonwealth grant, the university set up a free dental clinic at Common Ground last September.
So we're just going to have a little bit of a check-up, look inside your mouth. Do you have any problems that you've been having lately?
These students have been volunteering at the clinic since it opened, and it's been doing a roaring trade ever since, with 50 clients already through the door. But it's not just putting smiles on the dials of patients. These future dentists are learning excellent professional and life skills.
I really learned how much it actually impacts on someone's lifestyle. So from there you can really see how after your treatment they become really a different person, and it's really rewarding for me.
Okay, Radhika, how did you get on?
Yeah, good, Margie. So we've just
Under the supervision of a professional dentist, the students are able to put theory into practice. And dental hygienist and project manager Margie Steffens says the scope of the services they provide will grow.
We're working towards, doing root canal treatment, extractions, dentures, good restorative work, oral hygiene instruction, scaling and cleaning. So really the good bread and butter dentistry that we know that keeps people in good health physically and dentally.
Coming here, you really challenge yourself to try and formulate treatment plans that not just cater for their better dental health, but also for their overall medical health as well.
And that's a very real issue. The link between oral health and chronic illness like cardiovascular diseases, cancer and diabetes is well documented. And for those at a disadvantage, the stakes are even higher. A recent report by the National Advisory Council on Dental Health show about 40% of the population do go for regular checkups, but 34% say they simply can't afford it or have trouble accessing a dentist. With more than 7,000 homeless people in South Australia alone, those who established the clinic say it's a vital service.
I think it comes from a common interest, a common belief that dentistry and good health are not something that is exclusive, that it's for everyone, irrespective of whether you have money or not.
Some small gentle circles brushing up and where the tooth meets the gum.
Initially working at the clinic was voluntary, but this year Adelaide University has made it a compulsory part of study for final year dental and oral health students.
The way that we can provide them with a learning experience that is there, that they can go and use in society is the best possible thing that we can leave them with.
Professor De Vries says the university plans to expand the program to medical students and offer a free allied health service in the room next door. But he says while the initial funding was welcome, more is needed.
You can't just use volunteer people all the time. That is a fantastic part of the puzzle, but You also need full-time people in salaried positions. So you're enjoying?
Long term, they'll need to fund 3 positions, including a professional dentist, to ensure the clinic survives. In the meantime, the work they are doing is changing lives, one mouth at a time.
And you're free to go. There you go.
Maureen McCallum, for one, says she's found her confidence again and, for the first time in a long time, is genuinely happy.
I think it takes the anxiety away. Like I can smile without and laugh loudly and with a good set of teeth.
Nothing like